All right, viewers, welcome to another episode from Anything About Everything. And today I have super cool dental hygienist with me. Her name is Misty. Let me add her onto the stage. Hey, Misty, how's it going?
Hey, how are you?
Good, 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 good. You're the first guest that I have on this podcast where I have not spent enough time with, and you have impressed me enough in couple hours that we met to have you on this.
Well, and the funny part is my podcast is Hygiene Happy Hour, and I happened to meet you at the bar during happy hour.
Absolutely.
So,
Yeah, that was really funny. So I had gone out with my office peeps in Boca, and then I ended up staying in, where did we stay? Hyatt?
yeah, we were at the Hyatt, and I was with my office peeps, and that was actually who introduced us.
Exactly, exactly. Somehow vaguely like Erica started talking to me and she introduced you to you. And
Yeah.
the good part was you're a podcaster yourself too.
Yeah, absolutely. Well, new to it. Like I said, haven't launched yet, but new to it. And really excited about it. So far, I've just been, creating some episodes, and it has just been so fun because literally I get to like have a cocktail with, my friends that are around the country and get to like have a cocktail. And then on my podcast, we play like drinking games too. So we like educate on dental things, but then we just have a little fun, and then the loser has to like drink. I mean, why not? Just gotta liven it up.
Awesome. That's amazing. Mine is kind of that concept, but I try to focus on one different topic every episode. So I try to cover a lot. There's no exact niche. Just let's cut right to the chase. So I've seen in movies, right? They always say that dental doctors are not doctors. What is your take on that?
Well, we trust me, right? In Hangover, whenever that happens, all of the dentists are like, that get offended by it. They actually are doctors, though. They're the doctors of the mouth. And in all honesty, it really is kind of upsetting because it's like people think that the mouth is separate from the body, and it's like it's not. They're all one, so they're just the doctor of the mouth, of the oral care. And, you know, more and more now your mouth is connected with your body, right? And people are learning that, like heart disease, pancreatic cancer. The ones that I love to get the guys with is erectile dysfunction, ED, and that was like, oh yeah, I'll do whatever with my teeth, right? But the truth is the bacteria in the mouth causes an infection, causes inflammation, which then causes the bone loss around the tooth as well, which ultimately leads to tooth loss. But that takes a really long time for that to occur. But in the meantime, if your body carries this active infection all the time, right, in your mouth, and it's never, calms down to a level of health, then all that bacteria gets into the body and it impacts it, in ways of inflammation throughout the rest of the body. And so that impacts the liver, it causes people to have issues with diabetes. Not taking care of the mouth also impacts people being able to have birth. A lot of them end up with preterm labor, and or I've had some of my own patients when that would say they struggle with as far as coming in and saying that they struggled with pregnancy, right? That they just couldn't get pregnant. And then literally we finally got to the root of their problem, which was their oral health and the inflammation in their mouth, got them nice and cleaned up, gave them good, home care. And they were then able to get pregnant. So, I mean, and the science is there. The same plaque that's in our mouth is the same that we're finding in Alzheimer's patients. So, the fact that for some reason it's like, hey, you're not a doc, right? It's like, well, yeah, we are. And we also, it's a really important piece is that we're much easier to take a look inside you than somebody on the other end. So just come in open wide and have a fun time with us and let us check it out, because there's a lot of things that we also can, find out in the mouth just by looking at the tissue. Like people don't even realize like your tissue is going to respond differently There's lots of things that we can, somebody has acid reflux. We can tell that, typically in the mouth, there's just so many things that we can really identify if we'll just slow down and look. And if we get everybody to go to the dentist on a regular basis too, that would
That's
be,
that's that's very interesting. I didn't know so much. You can say so much just by checking someone's dental hygiene and the bacteria in the mouth. I swear I didn't know this. Um, Again, forgive me if this question is too much or it's coming out of ignorance. So, can you, if that's the case, why don't doctors use dental as the main preventative care? Like, if you say, "Oh, I can see the bacteria in the mouth," and I can say,
yeah,
"Okay,
yeah.
this
Well,
is
and you
what
can
that is."
test so much from saliva, right?
Mm-hmm.
Too. Like if you test saliva, there's a lot that you can test in it that will tell you like the health of the individual that's in front of you.
Mm-hmm.
I think that that's beginning to change where we're seeing more medical doctors and dentists work together to be able to care for a patient long term, especially when it comes to like patients that have cardiovascular, issues, right? The doctors, we know that that plaque and that bacteria gets into the heart and can cause infection and cause issues. So, you know, more now than ever, those two, they're talking, right? We're starting to have, the different doctors and dentistry, they're starting to merge together. And really, we're seeing dentistry move away from what we used to be, which was, the drill and fill, right? That was kind of
Mm-hmm.
like we waited, we watched stuff. Do you ever hear anything about like, oh, you have we'll watch this area, right? And I
Mm-hmm.
always, being, years ago when I first got in dentistry, I was like, what do we do? What are we watching it for? And they're like, oh, we're watching it for it to decay. And once it decays, then we'll fill it. That's
Mm-hmm.
dentistry. But that's really changing because of technology. And this year's the first year we have a dental code that we can, your insurance carriers and people, will take care of, which helps, everybody with their benefits. But it's this newer product that, or technology, shall I say, it's a polymer that we lay down on the tooth structure and it actually grows enamel back.
Wow.
So it's really cool. And like, I have the shirt I wear a lot and it says the drill free future. And I believe that because, like, if we can treat disease earlier, right,
Mm-hmm.
preventative, right, not that drill and fill model, what you were saying, if we can do that earlier, then that is more like the medical model. Because the medical model, right, we try to prevent disease versus dentistry was always like, well, we'll just wait. We'll just wait till it decays. We'll wait till that pocket's deeper. We'll wait till that tooth has lost, half of its bone and then we'll discuss it. Because that was the mentality is like, it wasn't as preventive as it is today. Now we're much more aggressive and trying to treat disease sooner than later because we also know that if we can help you maintain your teeth, then you're for a longer period of time, you're also going to live longer and you're going
Mm.
to be happier. You know why? Because smiles are a connection between you and I right now,
True.
right?
True.
It's I tell people all the time, and my mission is like, you can change the world with a smile. And that's, I work with a lot of different hygienists, and that's the one thing is I hope I instill in them is that, like, really, you can change the world being a dental hygienist. And that's why I wanted to be a hygienist because I know the impact of a smile. It can light up your day, right? You can not meet somebody ever before, like Ragu, you and I. It was your smile, right? It was you and I. We were sitting there having a drink, chatting, and we had Erica, who's always
Yep.
bubbly and wild. I love that girl. She is so good at what she does. And I am so lucky to be able to work with her every day because she literally is the best of the best, regional hygiene specialist that or trainer. I mean, you name it. That she's everything when it comes to to hygiene, and like she's just a gem to work with. And my whole team. I have had my whole team there whenever we met, but yeah, she is definitely um, she's a hoot.
She is. She is.
You definitely
Um,
remembered her.
I definitely. She's one of a person whom I can never forget. That's how impactful she is. She's super sweet though.
Mhm.
So, I mean, talking to you, I know, like, I had few questions in my head, but now I have different questions. So here's the thing. So you spoke so much about like physical health, right? Like, okay, this is how we can have dental and preventative care. Like, can you even predict something about mental health by dental?
You know, I mean, we do know that the bacteria in the mouth uh, does get to the brain and impacts the brain because we know about the Alzheimer's, right?
Mm-hmm.
So the thing is that when you think about dentistry, we're so young in the profession compared to like the medical profession, right? So
Mm,
maybe that might be also why people are always like, oh, are they a doctor or not, right? Because medicine's been around for a lot longer than dentistry. So, for instance, really, I think it's around like 1886 was the first dental kind of even like thought of it. And then think about it. It wasn't, I don't know, I can't remember the dates offhand, but I know for hygiene. So the first hygiene school in the United States was in 1914. And that was Dr. Phones. And that was up north. And so that one, so when you think about that, 1914 was when we started thinking, hey, we should clean our teeth, right? So we're really young in the profession compared to medicine. So I think that there's still so much that we're learning because I mean, it was only really in the last 20 years that it's been, hey, maybe your mouth is connected to your body. I mean, it is wrapped in a part of your head, close to your brain. Maybe we should think about it. That maybe something in your mouth. Oh yeah, and all that whatever's in your mouth is then going down your stomach, right? Down your esophagus into your stomach and then going out to the rest of your body. So maybe we should think about it. And two, it's this other thing that people think that like bleeding gums is normal. Bleeding gums is not normal. I always tell people, I say, or ask people, hey, if you brushed your hair and your scalp bled, would you be concerned? Hell yeah, you would. Think about it. If you were brushing your hair and your scalp was bleeding, wouldn't you be like, what's going on here? Right? But people don't because there's been this myth that, oh, bleeding gums is just normal and it's okay. Um, but it's not. It's a sign that you have that infection and you have something going on. So you should listen to it. Um, and that's where, like saliva testing and things like that too would also help because then we could figure out what type of bacteria. And that's where dentistry is going now, is where we can actually like test for things like that because we didn't really have that technology until most recently, right? Where we could test for all these things. And that's where I was saying, like, it's easier to look in your mouth than it is other places because but that's only just recently, and I think you're going to see more and more testing that way, um, because we're just getting the technology to be able to do it. Because nobody
got
really thought about, oh yeah, the mouth is part of the body, and so
it.
now when they figured that out, now they're like, oh shit, now we got to figure out what ways we can test and be able to utilize this to our advantage. And I think that you'll see lots of things change. I've done some testing on, tried out a couple different saliva testing things and, even pH. That's something I was just in, well, I was just in Houston, but I thought I was in Dallas. And then I realized, so I went to, um, last week I went to Houston, but I really thought I was going to Dallas. I don't know what I was thinking. So when I get to
How did you
Houston, I'm like, I'm in Dallas and this is where I got to go. And the lady's like, no, you're in Houston.
wait? How did you end up in Houston? And tell me what happened there. How did you end up in a complete different
No,
city?
no, no. I was supposed to go to Houston, but in my head, I kept thinking that I was going to Dallas because I thought the company that we were doing work with was in Dallas. That's just where I thought they were headquartered. Now, don't ask me why I never thought about I was flying into Houston because it wasn't called Houston. I flew into whatever their airport there, but it's not called Houston. It's called like Hobby or something. Yeah, it's Hobby. I think that's what it was.
Yeah, it's
So,
I was in Houston last week, so I know.
oh, you were? Well, I was in Houston too. Um, but it was Hobby. So I just Hobby Houston, I just, I didn't really, and then I don't know if I was thinking, I don't know how I got Dallas. I just swore Forward Science was in Dallas. Needless to say, even so much so that I thought I called a friend who lives in Dallas before I left to ask her what the weather was. So it was like a legit. And when I landed, I posted on my Instagram that I had just landed in Dallas, and Rob, who's the owner of Forward Science, I had tagged him in it, and he goes, "I hope you're not in Dallas." So that's cool that you were in Houston too. What were you doing in Houston?
I was in Houston. I drove all the way from
Oh, I think I
Boca.
remember you saying this that night we were at. You did. You told us that.
Yes, so I drove to Dallas to meet my nephew, my cousin's son. He was turning one. And then from there, I was supposed to go to Austin, but my plans got dropped. And my buddy from Maine, he came down to Houston for a concert. So we were in Houston Thursday, Friday, Saturday, Sunday, 4 days.
All right. Well, I was just there for Thursday, Friday. I was in and
Yeah,
out pretty much.
nice. So you live in Atlanta, right? If I'm not wrong?
Yes, I do. I live in Atlanta.
Correct, correct.
Yeah.
And
And you're in Tampa, right?
I live in Tampa. That's correct.
Yeah, I know I throw everybody off because I have a Tampa phone number.
You did tell me that. I thought I was the OG because I have 813, but what is the real Tampa number?
Well, 727. I mean, 813 is a legit, like real, but so is 727. Well, I'm the original OG.
So
It's
yeah, yeah, the
727.
OGs of the OG.
OGs of the OG, but I'm really not even. I only lived in Tampa for a little bit of time, for about 2 years, but it um it just worked out to keep the same number because when I moved, I mean, 10 years. I've had that number for over 10 years, and by that point, you had a cell phone and you didn't really have a home phone. So why did you need to change it?
Exactly, exactly. Um, so you mentioned something about very interesting about you figured out smile is everything that a person needs, or
Mhm.
smile is what starts off everything, right? And you said
Yeah.
when you figured that out, like it was amazing.
Yeah.
But my question to you is, have you always wanted to be a dental hygienist or be in the dental industry?
No, I wanted to be the first president of the United States of America. That's what I wanted.
Wow, talk to me more about it. Okay.
Well, I mean, I wanted to be the first woman president just because it had never been there. I was that little girl, just like, I always think about that there's a little girl looking up at me, right? Um, but I was just thought, wow, one day, how cool would it be for a woman to be president? And I wanted to be that. I also wanted to be Oprah. But my first degree, actually, or what I went to school for, wanted to do was broadcast journalism. I think we talked about this. Broadcast journalism, and I, you know, just that was really what my love was. I wanted to be, on entertainment and be like, and tonight on the red carpet. I just thought that would have been fun. Um, but I had an experience where, like in media, you like, and I don't know if it's like that now, but back then, because you got to think this is some 25 years ago, I have curly hair. And with my curly hair, I like when you're in media, you can't really have your hair curly. It's like a bad thing, or it was 25 years ago, right? It was like one of those things that like it wasn't as accepted. And you have to, when you're on in front of the camera, which is one of the things I wanted to be, they tell you like how you can wear your hair and stuff like that. And it's just a different kind of thing. And it wasn't what I ultimately wanted to be or do. And I had worked in dentistry in high school, right? It was one of those things I left halfway through the day, like my senior year, and went and worked in a practice. And I got to actually assist a dental hygienist and got to be a hygiene assistant and really enjoyed doing that.
This was in your high school?
Yeah, this is in my high school.
Okay. Okay.
So in high school, I got to do that. And so I went off to college for broadcast journalism, right? But then whenever I started realizing that I don't really like people to tell me what I have to do, like, especially like my look, right? Like, your look is something that's really personal to you, right? How you wear your hair, things like that. And so it just wasn't something I decided I wanted to do. And so I decided to pursue a degree in dental hygiene. And so I kind of changed my mind on what I was doing. I was a dental assistant in a practice, actually for quite a long while, like 8 years before I went to hygiene school. Um, because when I quit going to school for broadcast journalism, I went and worked in a dental practice. And whenever, I'd been there for like 5 years or so, he was like, you need to go to dental school or dental hygiene school. Don't, and so I was like, and I worked for a really good doc. I mean, we're still friends today. And so he really encouraged me. And so I was like, cool. He really wanted me to go to dental school, but I went to hygiene school, and honestly and truly, I fell in love with it because you really do. The hygienist is the one who gets to spend all the time with you, the patient, right? The doctors, they come in and out, just check you and leave. And then if you got a filling or whatever, they got to be the ones to go give you a shot and all that. But hygiene is like, the feel good, like therapist. You get to talk to people, you get to check in how their kids are doing. It's just a fun job to have. And, also it pays really well. People would be shocked at what hygienists, especially these days, because hygienists are hard to come by because so few people are going to school for hygiene. And it's like, I don't know why you wouldn't, because hygiene's, it can be a 2 year degree, right? It's a, well, not 2 years. It's really not. It's a 2 year degree, meaning you get a bachelor's. So it's a bachelor's program, but you have to do some prereqs beforehand. So really, in about 3 years or so, you get you come out and you're making six figures.
Wow.
Yeah. I mean, if you do it really well, I mean, you're at least somewhere around 75, it's around 75,000, right? But then that gets better depending on, if you're working, and most of them are, your schedules works 8 to 5. Most people only work Monday through Thursday. My favorite schedule was working Monday through Thursday and then Tuesday through Friday every other week, because then you got 4 days off every other week. So you could do like, you can easily do a little vacation in 4 days, right? Especially I live in Atlanta, so chat away. Go everywhere direct from Atlanta.
But the days that you work, how many hours do you work?
Usually 8 hours, yeah, when I was doing clinical hygiene. I don't do clinical hygiene that much anymore because I run a company, Sage Dental, uh, as far as their hygiene department.
Hmm. And what were the when you had that switch between the journalism to dental? Did you face any challenges in terms of like studies or like to get into dental college, like anything like that?
No, I mean, well, I will say back then there was a wait. So, I mean, I guess I did have a wait to get into hygiene school. And now, I don't know if there's a wait anymore for it, because what we keep hearing is that not as many, people are entering hygiene school these days. But it's kind of like a lot of things anymore, I feel like. We're not going to have enough electricians. We're going to have enough plumbers. you know, I'm trying to figure out what happened to all the people. Or
I
were the
mean,
baby boomers that big of a different beast?
yeah, I mean, I for me, dental is completely new. When you talk about misconception that you spoke about, right? Like
Hmm.
cleaning and drilling and all that, like I'm one of those guy who's filled with these misconception in my head. I'm good that I'm getting educated more on this. That's the whole point about this podcast, right? You have
Hmm.
one perception towards a profession or a certain niche, and then this opens up a different avenue. Like, hey, this is what you were thinking is true, but there's something else to that too.
Hmm.
So for me, I thought like visiting dentists once in 6 months is fine, or if not, wait until your teeth, is hurting and then you go to the doctor. That's the sector that I fall into.
Yeah.
So what you kind of mentioned about few misconceptions,
Hmm.
very nicely about the misconceptions what people have about oral health.
Hmm.
um what are the Do you face any challenges from the patients coming in and explaining their stuff or anything like that, and what's the tricks that you use to make them comfortable or make yourself feel peaceful at work?
Well, I think what you have to do as a hygienist is you just got to educate your patients. It's always their choice on what they want, but it's our job to, educate the patient on their oral health. And, like, if your hygienist is not probing you whenever you come in, where they take a measurement and they like call out the numbers around your teeth, if that's not being done, then you should go to a different dentist. Because that's how we're going to be able to tell, the real health of your gums. And what we do is we walk a probe around, which is a measuring stick. We'll call it a measuring stick. And we walk that around the tooth, at the in the sulcus. And what we're checking is see, first off, does the tissue bleed? Because remember, bleeding's not normal.
Mm-hmm.
Right? And how deep that pocket is. Because if it's a healthy pocket, right? Just like if you have healthy muscles, they're nice and tight, right? But when they get inflamed or they're infected, they get kind of loosey, right? They get looser or they flare up. So then, therefore, it's a deeper pocket. So because we're bleeding, we see the bleeding, and then we also see that the pocket depth is, 4 and above. And we used to not treat really perio back in the day. It was like 6 millimeters, and that was it. Anything under, and then it moved to 5, right? Now, the latest American Academy of Periodontology recommendations is at 4 millimeters, meaning that, if they're walking around and calling those numbers out, 4 and up, we should be treating in some type of periodontal therapy, be it gingivitis, which everybody has heard about gingivitis. So, gingivitis is the earliest stage of periodontal disease in which the gums are just bleeding, but there's no bone loss. Once you get into periodontal disease, then you have the start of bone loss, and that infection causes deterioration of the bone, and then it starts off mild, moderate, severe, kind of, right? That's the best way to kind of lay it out. Now, as clinicians, here's what your thing about the medical model. We now stage and grade disease with the new guidelines that are now in dentistry compared to what we had previously, which that change didn't come about till 2019. And in 2019 is when we began to really stage and grade disease of the mouth. Before, we never did that. So that's what I mean. Like, dentistry's changing so much. And now it's like, oh, it is part of the rest of the body. We need to treat it the same way. And so you're starting to see those medical concepts in dentistry come about.
Got it. When you talk about technological switch that brought about so much improvement in dental industry, that brings me always to my favorite question that I ask in every podcast is the AI question, the recent buzzword. So how big of a role does AI as of now play in dental industry?
AI is growing so fast in dentistry. And I have to say, I'm just so I love what I do because I work with the best um, doctor, and she is so involved in AI, and she absolutely loves it. Matter of fact, she was like written up as one of the top, AI, you know, women, right? Women. She's a woman dentist. Um, Dr. Cindy Rourke, I'll plug her out there. But she's so great at AI, and she has, went to school and learned all about it, and she's just so techy and so advanced, and I've had the honor to work with her. And we've done lots of cool things with AI. There's lots of AI technology now that will read x-rays. So the big thing for dentists is that if you put 10 dentists out, right, and you give them all the same x-ray, this is a proven study from Harvard, 7 of them are all going to say something different. Only 3 will be the same,
Hmm.
right?
Why
Because,
is that?
well, that's just because where you went to school. Are you going to watch it? Are you going to treat it? Right? Because there's all these different philosophies out there. Versus AI, where it's really bringing the dental community, is it's really looking at, AI takes millions and millions of pictures, right, of the mouth, and it keeps learning more and more. You understand AI.
Mm-hmm.
So, you know, it has a much more trained eye than, per se, than even a doctor who has just looked at 1,000 x-rays, right? Because AI's looked at way more than they have, because it has the capabilities to see so much more. So it makes it pretty damn accurate. Right? And it creates consistency, versus when you have all these doctors, because it's like, okay, check, that's decay. Check, that's decay, right? Versus you have a couple doctors, well, that's kind of decay. That looks like we'll put a watch on it and we'll check it in 6 months and see what we're thinking. Or, how about this? Why don't I give you some topical fluoride? You can use that, and then I'm going to send you home with this, and you use this every day. So, right, there's all these different philosophies too on how to treat it. Versus, AI really is going to lay it out like, hey, this is what's needed. And then the doctor can make the determination. They still have their own clinical judgment. But what I think that's really great about it is it's really creating consistency. Because, for me, the big thing with hygiene is periodontal disease. That's what hygienists treat, is periodontal disease, which is the disease of the gums, the bone, the supporting structures, everything below the teeth. That's really hygiene. The biggest part was bone loss, right? So bone loss, hygienists, we do everything underneath the gums, which is the supporting structures. And the great thing about it is we always used to question, like, is that bone loss? Or you'd have one doctor say, oh, that's not, because a lot of it's based on 20% of bone loss, 30% of bone loss, right? Like, and then you're kind of, that's how you move up the chart, right? The more bone loss, the more severe your disease is. And so between 20% or 40%, right? That's kind of subjective. If you and I are looking at something, it's going to be subjective, versus AI is not as subjective. And so I think it just really creates that consistency and allows us then to identify also early curious lesions, versus before we really weren't paying that attention to them, because they're not, how something's kind of decaying is like the shade on an x-ray, right?
Hmm.
So the darker it is, the more decayed it is. Makes sense?
Got
But
it.
but it's shades. So you may see a shade a different way than I see a shade. Kind of, are you following me? Versus
Mm-hmm.
AI is going to pick up that like and nail it every single time. And so it allows us to treat these earlier, because it's going to notice the shading and variation in the tooth structure earlier than you can see with the naked eye.
Got it. So you say, especially in dental industry, AI is making significant progress in a right way.
Significant. Oh goodness. And I think it's just going to keep changing constantly. I mean, there's also like AI for auto charting. So that helps out, like, where we can take your x-rays and automatically chart it for you versus, somebody going by hand and drawing it out or putting it in the computer. We automatically chart it based on what's in the x-rays. The one thing that we don't have that maybe one day will, and that's a really hard thing to come up with, is how you do that part where I said the hygienist should be probing and walking and taking those measurements. We don't have a good way to do that yet. And if we could really figure out a good way to do that, man, we could almost just AI it through diagnosis, and then you'd have to have a person there. But you'd have to have a doctor approve it and make sure they're in. But it would create a lot of consistency, and you could reach a lot of people. For instance, like teledentistry too. If you had like you could create like an app or something that could use AI and then tell the person like how their mouth is, right? If they have any areas of concern. And I've worked on a project like that. It's going to launch here soon in the US, and they keep changing its name, so I don't even know what name to call it. But really cool technology, and it really can be with an iPhone, or a smartphone. I have an iPhone. I'm an iPhone user. Got me. Um, but if you just literally take it and you can scan, and then it'll tell you like this is an area of concern, this area is like an emergency, this is a decayed area, you need immediate attention, or hey, this is an area of health. Right? That technology is coming. Um, it's just really cool to see it. And like I said, I really have this really amazing opportunity that I get to be one of the first people that ever sees it, because I get to work, at a place that is so technology savvy, that is just super impressive. I know you got to go to one of my practices in Tampa.
Oh yeah. Oh yeah, for sure. um that's amazing. Wow. Because like I've always, whenever I've asked my guests, there's always like sometimes some people have some concerns about AI. Like you're one of the first guests who's had no concerns about AI in your own industry, and you didn't mention any challenges that you would face with AI. That's pretty astonishing.
Yeah, I mean,
Um,
I think there are probably things that we could find, like one of the biggest things that I do here is that doctors say that it's too sensitive, right? But I think it's also because we were trained not to worry about it until it got to this point, right? And AI is trying to catch it before it gets to this point,
got it. Got
because
it.
we were always so focused in on the drill and fill, right? So focused in on we will treat it when it hurts.
When it hurts.
When it
Yeah.
hurts. And that's been how society has thought about it. That's how dentistry has thought about it. And it's like, I think that's really changing. And I think you're really going to see that begin to change in the next, 10 years. And more than anything, I pray to God it does, because we have there's so much that dental hygienists can offer to the community and to, patients. We just got to also, let them get out there. Because that's the other thing about hygiene that a lot of people is that a lot of states restrict what hygienists can do.
Hmm. Interesting. So, what is your thought on the Invisaligns that where the Smile Direct Club they sell it online where you just
Oh,
send an imprint? What is your thoughts on that?
so I think whatever you were going to do, it should have a dentist involved in it. Okay. So clear aligners, 100% they work. I prefer them over traditional braces because you can take them out and you can care for your teeth, right? When you have braces, you get all this metal in your mouth. So it's really hard to take care of it, which then becomes a place that plaque accumulates because it's hard to get,
Hmm.
right, and then it then causes this bacteria, which then causes the gums, causes the infection, right, all the stuff we've been talking about. So it's really good to have clear aligners because they give you the ability to do that, and they really work. And you don't have to go to like traditionally so many appointments per se, because like I have a 10-year-old who's in traditional braces, and we're having to go every other week because she's, a wire's breaking, right?
Mm-hmm.
Versus, clear aligners, you just put them in, you wear them for a week or two, and then you pretty much move on to the next clear aligner, right? So it's really nice. And then two, utilizing AI now, there's these great scanners that you can actually scan the mouth with while you're in your aligners, and it'll let them know if it's seated, if their teeth are moving properly, if they're doing their home care, and all that type stuff. So then, if you're a patient in the clear aligners and you work with a dentist that utilizes that technology, you then have the ability to not go to the dentist every dang week or every other week when you're in braces, right? Because time is money and we're all so busy. We don't have time to go in and do that. So if you do that, then you're just going in, every, month, 2 months or whatever that regimen will be that they're going to give you, the set. Like my son, I think we got like 13 cents, right? So
Mm-hmm.
we went, you know, quite a time. Like I said, you're wearing them 1 to 2 weeks. So that's a ways. Now we saw them in between. I will say we did go in and see them, but we were still scanning. And as long as that's why I actually had to go in because our thing wasn't scanning. But when we were scanning, and she could look at how he was progressing in his braces, right? Because it takes the scans with his iPhone. Then the doctor could look at it from afar and could see it and just communicate to us through the app, which was way cool compared to doing it like that. Now, you asked about Smile Direct Club. Now, Smile Direct Club just filed for bankruptcy, which is really sad for the patients because I had saw on their website that even after they filed bankruptcy, you still got to pay them. So I still feel really bad for those people that are in the midst of treatment and really are now having to look for somebody who'll take over their case because it's really hard to take over a dental case like when you've been moving teeth around if you didn't start it at the beginning. Because, if you started at the beginning, you kind of know like where you're going to lay things out and, move this tooth here to give room here. But if you hadn't been part of the puzzle from the get go, it makes it a little difficult to do. So that's really it's hard sometimes to get an orthodontist or a doctor to take on like somebody else's case. So I feel really bad for those people that are in that Smile Direct Club left in that manner. But also, I just Smile Direct Club, you know, my understanding that they didn't really have a dentist on site. So you would go in and they would take a scan and then they would send it up to a dentist offsite. But here's the thing, they didn't take x-rays to my understanding, which meant that we didn't know, do you have any decay? Do you have any bone loss? What's your tissue health, right? They don't have any of that data. And what I saw clinically when I was treating patients, and this happened to me even like a year ago. I was in an office and I was treating patients, helping out, and I had a patient that literally had like 9 millimeter pockets. Like, so when we probe, 12 millimeters is like the worst. Okay, pretty much. I mean, you can go up to 15 or so, but depending on the tooth, because every tooth has a different. But either which way, that's really bad. And she literally, like, when I was probing and kind of checking her out, uh, her teeth were mobile. They were moving. And, had she had an exam by a dentist beforehand, before getting in those aligners, which then moves and shifts the teeth, right? Through the bone that's infected, but they didn't check to see if she had, healthy tissue or not. So therefore, her periodontal disease was eating up, and then they were moving it. So it's like two, because anytime you're moving, bone or you're doing something to tissue, think about it. It's going to cause it sore. It's going to cause it to be inflamed, right? But then you also it's already got an infection there. So now we're talking this stuff's moving a lot more. So ultimately, I felt really bad for her because there's really not much you could really do at that point because it was ultimately she was going to lose some teeth. And here she is, she spent this money on something she thought was doing her justice and it didn't. And that's one of the things, there was a lot of lawsuits out on them too, I think, as well. Um, And I hated that because I get the concept, right? Which was they were trying to make ortho more affordable, right? And I do agree that that is helpful, but I do think clear aligners has created a pathway for that, especially when you start putting AI and things a part of it, because then you don't have to go to the dentist every single time, is right? Then you don't necessarily have to what a normal office visit would be. Now it's not going to be as much because they can quickly look through them. Does that make sense? So I think for the consumer, AI in that regard is also going to be good for them because I think you'll start to see that. Plus, all the metal and stuff that's more expensive than even the aligners are, or they're continuing to get that cost lower and lower, right? Depending on the different types of plastic, because you do have to have really good plastic because you got to think we're moving teeth with it, so it needs to be of a certain caliber to be able to do that. But yeah, I'm a fan.
Cool. As far as I know, yeah, I didn't do it. I wanted to do it, but for me, I like the involvement of human dentist when I do something. And this one was completely online. You sign up online, they send you an imprint, and you take the imprint yourself and you ship it, and they send the retainers. So I was like, wait, I'm not comfortable with that. Where nobody's actually checking me, but they're sending something. So
Yeah,
yeah,
and
thanks for
yeah, no,
clarification.
that's exactly right. I just learned about a new one this week. There's a new company out where people can get night guards that way too, where they send it. But I would be kind of a little questionable about that too, because you want to make sure how your bite is, too, and just I think you just should always have an evaluation first, you know.
Exactly. Exactly. Yeah, for me, like when I think about dental, I'm from India, so when I think about dental, at least dental procedures in US is super expensive. So I go for test here, but any procedures I get it done in India when I fly down to India, like it's a whole thing when I get it done. But yeah, probably I don't know which side of dentistry is more advanced or which side is right. I
Well,
just think of fast most of the time.
America's going to be more advanced mostly than India than what I have seen. Just they're not as on the periodontal health piece, right? As not, you know, that they're still more focusing on it whenever it hurts more in that culture. It's definitely more the culture that, and so because of that, that's kind of how they treat majority of things over there.
Yeah, in India, like I got used to the system of going to dentist every 6 months, 6 to 8 months, like after coming to US. In India, like you said exactly, I just go to dentist when it hurts. And that's what
Mhm.
my parents do till today.
Yeah. No, I know that because I worked with a doctor for a long time. Actually, it's one of my favorites.
Uh-huh.
And he's Indian, and a lot of his patients would come in and they would, be like, no, kind of like this, my gums bleed. Yeah, but it's not hurting. Well, that's the thing about periodontal disease that people don't realize. It doesn't hurt until it's too late. Because with periodontal disease, it doesn't hurt until it's pretty close to time as we're losing that tooth and extracting it. Versus if we could have caught it early, then that would, we can maintain your teeth for years and years and years. Because we can stop the bone loss from occurring, clean those areas up and help you keep it clean at home, and then you're good. And then even now we have great things like periodontal trays. My husband uses those, and he wears them just 15 minutes a day. And so after he brushes his teeth, he puts these in, and it's a hydrogen peroxide mixture, and it creates a pressure, kind of almost creates like a hyperbaric chamber, and it creates that environment when the peroxide goes into the sulcus, goes in around the teeth, and it creates this effect. And so what it does is it kills that bacteria every day. So really, long term, I think it's going to end up where everybody has that. Matter of fact, my friend called me last week, and she was like, my mom's having surgery and I'm worried about her periodontal health, I want to get her in some perio trays before she goes into surgery because she's having like a knee replacement, right? And one of the bad things about a knee replacement is like it getting infected. And that same bacteria in the mouth goes through the body and it's going to catch, the weakest point at that point. And so that's why she wanted to make sure that her mom had periodontal trays.
So talking to you, I feel like I'm reading a dental Wikipedia, right? You know so much about it, and the best part is you're super excited to talk about it and explain everything in detail. That's the best part.
Yeah,
So
I
I
love
figured
it.
you would be the right person to ask this question. So somebody who wants to pursue their career in dentistry,
Hmm.
where do they start? What do they do? Can you give the person who's interested to pursue their career, can you give like a complete rundown how they get to where they want the best way, the
Yeah,
right way?
the best thing to do is try to go and shadow at a practice, right? So that way you can go in and really see if you like it. Um, and then the next thing I would do is I would um, shadow the different things in the office, not just like go watch the doctor, go watch the hygienist, go watch the front. So you can kind of see all the different pieces and how they fit together. And then if you really like it, then kind of go towards whichever way you're leaning. Like if you want to be a dentist, then you would kind of lean towards the more restorative side of things. If you want to be more preventive, then that's going to be the hygienist role. And if you want to be, an office manager or, on that side, the business side, that's a great way to go. And then also a DA. I mean, I was a DA for 8 years before I ever went to hygiene, and that's a dental assistant. And the dental assistant is a key to the office, because they help the hygienist and the doctor and the patients, in the practice. They're really essential. And, had I not been a DA first, um, I don't know that I would have ever really went into dentistry, right? And the great thing about being the DA position is you don't necessarily have to go to school for it. I mean, it's great if you could take, but a lot of offices will hire you and train you, at least, while you go in and shadow. So it can be like a start of a career and then kind of lead you down that road where, which path you want to go.
So are there any, like, even you're saying even before going to school you got a shadow, so
I
are
would
there any?
shadow, yeah, like go to a practice, go to your dentist and say, hey, can I come in and just shadow for the day so you can see how a dentist practice works? Um, because I think that helps. Now, I have seen people that have never went to dental, never shadowed, and then go straight to dental hygiene school. I've definitely seen people do it and do okay with it. But I think it's better if you have some knowledge going into hygiene school. I think that gave me an advantage being a DA beforehand. I think it's gave me an advantage my whole career because I knew every aspect of dentistry. Because I've been an office manager, I was a DA, I was a dental assistant, then I became a hygienist. The only thing I haven't done um, is be a dentist, and I really did miss my calling. I should have followed what Dr. Ferguson told me to do all years ago and went and became a dentist. But I do love what I do, and I would do it the exact same way because it's been a phenomenal career, and I still have 25 more years of it. You know.
Nice. Yeah, so is there any tips or tricks for someone to pick who they shadow?
I mean, I think you'd want to shadow somebody who loves their job. Because I think that's important if you go into somebody because I also think that, you know, some people I've seen hygienists that and or doctors and so forth that are in that career and it's because they went to hygiene school, but not necessarily something they love. Right. Like I love dental hygiene. I absolutely love every aspect of it from, probing the patient to, taking x-rays to, I really enjoy it all. To doing teeth whitening, that's one of my favorites. I love doing. Um, but yeah, that's just, I think just look for somebody who really you see that they look like they're enjoying what they do, because I think that's really important for sustainability of anyone's career.
And can you give some insights about timeline, like how many months or how many years they should shadow and how long the
Oh, I
college
mean,
and
just shadow for like a couple days. Not they don't have to
okay.
shadow
Oh
for,
wow.
yeah. It doesn't have to shadow for a long period of time. It's just go in and learn a little bit about the dental office before you decide to go to school for it. I would encourage that for anybody before you went to law school, right? Like my son was interested in going to law school, and I'm like, hey, see if we can find an attorney or office where you can go work for a day and see how maybe it runs. I think that's for anybody. Did you jump into your engineering career and never know an engineer?
I mean, I'm not an engineer, so I'm more of a data guy
Data,
and
data. Okay, so
data
data.
data.
So before, did you know anybody who did data?
I did.
Okay, was it your dad or somebody or a friend?
Now one of my buddy, like
Okay,
he was meddling with numbers, and I felt it was pretty logical. And then when I was in college, I got a handle website and social media for a real estate company, and I felt it was super fun because the whole point was to get them more traffic on their websites and get more click. So that's what I even do right now. So yeah,
hmm,
that's how I figured, okay, this is what I'm doing.
okay. Well, cool. Well, but that's what I mean. Like you shadowed or knew somebody else. That's why I think that's an important piece to any career is because you don't want to get too far down, in that one career and then be like, crap, this is not what I want to do, or get into it, which I think happens nowadays to a lot of people, is they're not doing what they went to college for,
Oh yeah.
right?
Yeah.
I,
I know a lot of people like that. Like in my company, there's a front end engineer. Like he's complete like proper tech guy, but I think he did his degree, his undergrad in chemical engineering, like chemistry.
yeah.
Yeah. So yeah, that's interesting. Shadowing. Okay, awesome. I never knew this. I thought when you wanna go to dental, you just go to school and learn it and just start practicing it. I never knew about the shadowing part of it.
Yeah, absolutely.
Yeah. I mean, those are the dental questions that I had. It was a lot long dental hygiene questions. So let's talk more about lighter side of life. So what what how do I ask this question? What motivates you every day to do what you do? You have a podcast, you have the profession going, like what is that? What motivates you?
I think what motivates me is impacting change for the better for the future. That I really do carry this weight. Like, how I said, like, when I grew up, I wanted to be like the first female president. I wanted to be, you know, I just want to be the leader so that I can set this platform and make it easier for the next person. And I think that's really one of the things that, for me, I didn't really necessarily have that person too that I kind of looked up to. And so I really try to be that person that somebody can look to. And I think that really inspires me to make a difference and make an impact. And, my favorite quote is that it's the crazy people who believe that they can change the world are the ones who do. And I like being a little crazy. And, when people tell me I can't do something, I'm like, well, hell yeah, watch this. And I love that. And that motivates me to impact change and make a difference. Um, because if, there's just so much we can do to make the world a better place. And, I chose to do that in my own profession, in a lot of ways. I mean, I do, some charity work and, mentor, a kid in the school and stuff like that. But what I do really do is that I really try to impact change in my profession and make it a better place for, hygienist, but also for the patients, because, I'm really trying to stay on top of the advancements that are happening in dentistry for the better of our patients. Because it so many people just don't know what they don't know. And so I want to be able to, me being a part of this, as you have a different audience than I will have. And, I want people to know that their oral health is part of their overall health. Matter of fact, you cannot spell overall health without oral health. And it's so important. And I really just want people to know that and to take better care of their teeth, because not only does it take care of their physical health and their body, and one day we'll know more about their mental health, but it also helps with their confidence, right? Like if somebody has, let's say their breath doesn't smell well because they have periodontal disease, they're not going to be like, I mean, one of my favorite stories was this guy that came in one time. And the reason why he came in is because his new girlfriend told him that his breath stank. And
Mhm.
so he came in and we were like, well, he's like, well, they had been telling me I needed to have scaling and root planing, which is what you would do to treat it. And he's like, but I just wanted my free cleaning. I just wanted to get my teeth cleaned for free because I thought it was just that they're just trying to make me pretty, right? Just to keep my teeth clean. And I was like, no, sir, the reason why they've been trying to get you to have scaling and root planing is because you have periodontal disease, which we've now told you several times. And you've been adamant that you only want your regular cleaning. And he's like, well, my wife never said anything about it. And I was like, yeah, you're divorced now, so maybe that was just fine there, buddy. And then now his girlfriend now said something to him about it. So now he wanted to make the change, right? But it's like there is nothing we have that we're going to be telling you have disease that you don't have disease. Like we need, it's important. And even here's the thing: it's always better to overtreat than undertreat, right? Like it's better that you go and treat the disease as earliest than to let it just keep eating away at the bone. So, I mean, I really do. I just want to, improve everyone's knowledge of oral care. And I don't want anybody to be like, "Oh, dentistry, they're not dental professionals. They just clean teeth." No, we're not, man. We are oral health care providers taking care of you one patient at a time. Because smiles is a connection, right? I mean, if I didn't smile at you this whole podcast, it would feel very different. It would not be good because, smiles lights up a room. It changes the way you talk, your diction. And so there's just so much that a smile brings. And so I know that. And so I try to impact that with, like I said, with hygiene in the hygiene community, with the things that I've done and worked to get legislation. I've helped a couple different states with, helping get anesthesia through for hygienists to be able to do anesthesia. I'm working now to work and get lasers for hygienists to be able to do, because lasers treat periodontal disease uh, very easily, and it's actually more affordable for the patients in a lot of times, right? Things like that. But that technology isn't allowed yet, and where I live for hygienists to be able to do that. So I hope to impact that. Um, I with AI, I think there's lots still that we're going to learn. And like I said, saliva testing, there's just so much that's so new in dentistry. And like I said, I just think it's so cool that I get to be a part of it, and hope that whatever I do, it impacts change for everyone, because that's my legacy. So right here, when we're dead and gone, somebody's going to listen to this podcast, and that's what it is. That's my legacy. Right? Smiles on the making smiles on earth. That will be my legacy.
Awesome. I'm pretty sure that's what people are going to remember, and I'm very confident that everything that you're setting out to do or set out to do, everything is going to happen. I'm pretty confident. Um, so I have another question. So knowing what you know and going through what you've gone through, is there anything that you would go back and change any point of your life?
At any point in my life, anything that I would change. You know, everything that I've gone through has made me who I am today. And I think she's a pretty cool chick. It took me a long time to really really learn to embrace me and who I am because, I didn't grow up with the greatest self-esteem, right? Just I had a bad environment and not a family situation. So that was, I guess, the most promising. I was raised by a single mom, but also ended in foster care. And I don't want to get too much into all that. But um, but it made me who I am today. And, it gave me a different perspective than others. And it's made me hustle more than anybody because I had this thrive to prove that I was good enough, to prove that I deserved it. I hated the word no. And so I just keep striving for that. So yeah, I don't think I would. And I've made some big mistakes. But you know what? I learned from them. And there's nothing that will ever take away from my street cred, right? Because I learned it and I learned it the hard way versus somebody telling me or reading in a book. Um, I think there's value in that, but I don't think anything is ever more valuable than really street cred and learning it for yourself. Um, so mistakes are there to learn from, and hell, I had a lot of fun times too. So
Cheers for all the fun times.
here's for all the fun times. Yeah, I was gonna say my cocktail's empty.
um, Interesting. So, would if I ask you another question,
Mhm.
who is there any person who is your biggest teacher in your life, or is there any instance that has taught you a lot in life? What would that be, or who would that person be, and what's the learning?
Oh goodness, there's so many things that I have learned. I'll tell you the one person that probably impacted my life the most is Carolyn McCarthy, who happened to be my she I was in a place called the Rainbow House, and she was it's like a home for foster children, and she was the house director. And she was new, probably like 23 years old, cute as a button. And I'm probably 12 or 13 at this point, and bad out of hell, headed down the wrong direction, all those type things. And didn't have the greatest example either, right? And where I was, there was a lot of things going on. And she told me, and it's one of those key turning points in my life, was she said, you get to choose, who you are and who you become, right? Like, you don't, just because that's who your family is, or just because that's who, what you've gone through, right? Like, no matter what, like, you choose who you want to be. You get to be like, at that point, I'm like 13 years old. She's like, you get to choose who you want to be and what you want to do. Nobody else is going to choose that for you. And I think I really realized that like, as I got older in my teenage years, and I realized, hold up, I get to choose. Like, I could go to school for what I want to go to school for. I can do, and then I was like, okay, then I'm going to be who I want to be. Right. And I'm going to strive to be what, I always thought this person or thought should be a career and all those type things. And I've worked really hard for that, and have really strived, and it has not been easy at all. Um, but it's been worthwhile, right? And I love what I do. I mean, I work a lot, but I absolutely love what I do, and I would do it all over again, without a doubt. You know. And then, as far as life, as far as parenting, that has taught me a lot as well. Parenting has taught me patience. Parenting has taught me a love that I don't think you ever really understand until you become a parent. Um, and the other thing about parenting is they're all different. Just because you have the same, mom and dad, or just because they're your DNA, doesn't mean that they're going to be like you and think the same way that you do. They can be raised in your same household and all those type things, but they have a right to their own opinion, and they get their own opinions, right? And they have that. Um, and so that's definitely been, life lessons as far as, parenting teaches you a lot, but definitely a wonderful joy of life, but also the struggle is real.
Yeah. Um, I've, I mean, I'm not a parent yet, but yeah, parenting is amazing. I see my cousins do it. I see my friends do it. Yeah, they have a different joy altogether when they talk
Yeah.
about their daughter or son.
It
Yeah.
is. It's very special. It's like, dude, like I made that. That's like a whole, right? Yeah. I mean, it is pretty impressive. And then too, when you like see yourself in them, or you see the way they think about things, um, it's really cool to see. And it's cool to see. I mean, I have two older boys now. I have a 19 and a 16-year-old, and then I have a 10-year-old little girl. But it's really cool to see that they like how they're all like becoming their own person, especially with the boys, like, and what they want out of life and the way they think about things. It's really kind of cool. I'm like, man, you actually might be kind of cool to hang out with eventually. Right now, I'm still your parent.
Awesome. Any last word that you have for my viewers who stuck
Ah,
around so long?
yeah, brush the teeth that you want to keep. Take care of them. Brush and floss the teeth you want to keep. And then to Ragu, I want to say thank you so much for having me. And if your viewers are ever interested in anything dental or learning more about the dental office, check out my podcast at Hygiene Happy Hour with Misty Mattingly.
Awesome. And I appreciate you hopping on and supporting me in this venture. Thank you so much.
Yeah, absolutely. I appreciate it. It was nice meeting you in a bar and other stories. Who knows? We might meet again. Let me know whenever you're on that side of town and vice versa.
Oh, sure. I'll hit you up when I'm in Boca if you're around, or if you are in Tampa, just give
Yeah.
me a shout out
Or
and
if you're
yeah,
in
we can
Atlanta,
probably.
let me know. I'm in Tampa next week. So,
Oh, yeah, you should hit me up. We'll probably
yeah.
go grab drinks and talk more
Okay.
about dental hygiene.
All right. Well, thank you, Ragu. I appreciate it. Don't forget to brush your teeth.
I will. Good
Bye.
night. Bye.
Good night.